Low-tech details. You know, you hear all the time about some new high-tech piece of equipment or some sophisticated procedure that's supposed to revolutionize medicine, but oftentimes it's still the simple things that really work best. And one of the simplest things that's come along these days is the balloon catheter. Thin tube with a balloon stuck on the end that can be blown up, and you can do a variety of things with it. You've probably heard of it as a way to open up clogged arteries. Well, now that same simple balloon is being used for all sorts of other things, including a new way to restore fertility for some women. It wasn't all that long ago that this crib was empty, and Vicki was still trying to have her second child, an effort that really wasn't going all that well.
I thought it was pretty strange that I didn't conceive right away because I have an 8.5-year-old, and when I planned to have her, I had her right away, no problems.
But there did seem to be a problem this time, so Vicki and her husband Jim went through a whole variety of fertility tests.
She underwent a dye test, basically, to outline the uterine cavity and the tubes, mainly to see if the tubes were open.
The HSG showed that I had blocked tubes, and so we discussed perhaps in vitro fertilization.
No, that's fine. Instead, Vicki opted for a new procedure called a balloon tuboplasty. A thin tube with a balloon on the end of it is snaked up through the vagina and the uterus and on into the tubes that normally carry eggs into the womb. Now, when it reaches the blocked part of the tube, the balloon is inflated, and that opens up the obstruction, allowing eggs to then fertilize normally.
We anticipated complications during the procedure, such as infection in the tubes, bleeding, or perforation. We have so far not noticed any complications due to this procedure. In 1/3 of our patients, the tubes reblocked after 6 months when we reevaluated them. The remaining patients remained open or conceived, so we believe that about 2/3 of the patients will remain open.
I was kept very comfortable during the procedure. I didn't feel a thing. It was completely painless.
And best of all, it worked. They're now the parents of a 13-week-old baby girl. In fact, it worked so well that they even want to have another baby soon. Now, when you consider that a fair number of infertility problems are the result of fallopian tubes that have become narrowed down or obstructed, then it becomes pretty obvious that this tuboplasty procedure could see a lot of use. Now, what if this doesn't work? Well, just like when you try to open up clogged arteries with the same kind of balloon, if it doesn't work, you really haven't burned any bridges. You can still go back, you can have traditional surgery to open up the tubes, or, for that matter, someone could try in vitro fertilization.
Which is also increasingly popular.
Mm-hmm.
All right, thanks a lot, Dr. Twillman.
Okay.
Coming up next, the day's news in sports, including